mental disorders are metabolic disorders of the brain. And what that means, the science gets overwhelmingly complicated fast. There is no question about it. But if you do a deep dive into these tiny things in our cells called mitochondria, you actually can begin to understand what would cause a neurotransmitter system to become imbalanced. Why do patients with mental disorders have higher levels of inflammation? And why do higher levels of inflammation cause mental disorders? How does trauma and stress play into mental illness? Why do drugs and alcohol play such a critical role in illness?
Good afternoon, everyone. Thank you so much for joining us. We're really delighted to see you all with us for this event that's being presented in collaboration with MindHealth360. Tonight's guest is Harvard psychiatrist Christopher Palmer, and he's joined in conversation with Kirkland Newman, the founder and editor of MindHealth360 and the host of the MindHealth360 Show. We're delighted to have you both with us. Kirkland, over to you.
Thanks so much. Thanks for having us. Thanks to Dr. Christopher Palmer, who's one of my heroes, and thanks to the How To Academy for hosting these wonderful events. So just to let you know a little bit about Dr. Palmer, who has really taken the mental health world by storm and is really revolutionizing mental health, I think, in a big way. And so we're really excited to have him here. He's a Harvard psychiatrist and researcher working at the interface of metabolism and mental health. He's the founder and director of the Metabolic and Mental Health Program and the director of the Department of Postgraduate and Continuing Education at McLean Hospital and an assistant professor of psychiatry at Harvard Medical School. For almost 30 years, he's held administrative, educational, research, and clinical roles in psychiatry at McLean and Harvard. He's been pioneering the use of the medical ketogenic diet in the treatment of psychiatric disorders, conducting research in this area, treating patients, writing and speaking around the world on this topic. Most recently, he's proposed that mental disorders can be understood as metabolic disorders affecting the brain, which has received widespread recognition in both national and international media outlets. And his book, Brain Energy, I have to say, is a masterpiece. So, Dr. Palmer, welcome. And I'm just so thrilled with the work that you're doing. And we'll have about 45 minutes to talk, and then we'll open up to questions. But there's no need to go into the sort of mental health epidemic and the fact that, we're really struggling to treat mental health. There's such a mental health crisis. We know that 1 in 10 people have a mental illness. 50% of Americans have a mental illness at some point in their lives. 1 in 3 people experience an anxiety disorder in their lifetime. You are a conventional psychiatrist who has discovered what you call a unifying theory of mental and neurological illness. And that is the brain energy theory. And, it is such a revolutionary way to approach mental health. You show that there's a common pathway for all metabolic, psychiatric, and neurological disorders, which revolves around metabolism and mitochondria. And your approach is really proving revolutionary in terms of fantastic outcomes. So tell us a little bit, how did you discover this? What took you from being a conventional psychiatrist to coming up with this theory, which is so groundbreaking?
The real answer is I could talk about that for probably hours on end. The short version is that, I think that some of the first clues were from my own personal experience, that I had actually suffered from mental illness when I was a kid and an adolescent and young adult, and different diagnoses. I had OCD, I had chronic depression, I had suicidality, I had other things. And when I was in my 20s, even though I was normal weight, I was exercising regularly and I was following a super low fat diet, I had metabolic syndrome. And I ended up changing my diet to a low carbohydrate diet in a last ditch effort to see if it could improve my metabolic syndrome. And I noticed dramatic improvement in my mental health. Within probably 2 or 3 years, I started using that approach in some patients with treatment-resistant mood disorders and personality disorders, anxiety disorders. And for some of them, it was incredible. The results were incredible. For the most part, I laid low with all of that because I didn't understand the mechanism. I wasn't really that interested in trying to figure out a mechanism. I recognized that this sounds like quackery. I want to keep my job. I don't want to lose my license. I'm just going to shut up about this and just treat the patients in front of me, and still using very standard traditional approaches, including medication, psychotherapy, ECT, TMS, all of it. But for some patients who were interested in changing diet or exercising or using other lifestyle interventions, I was using them. And then everything changed in 2017 when I helped one of my patients with schizoaffective disorder lose weight. And we ended up trying a ketogenic diet for a variety of reasons. And within 2 to 3 months, his psychotic symptoms were melting away. His hallucinations and delusions were receding in a way that I had not seen in the 8 years that I'd treated him. And this man had been on clozapine. He had been on numerous antipsychotics. He had been on lots of other classes of medications. He had been in and out of hospitals, including McLean Hospital, which is the top-ranked psychiatric hospital in the nation here in the United States. He had been in high-end residential treatment programs. So this man got the best of the best care, and he was still ill. And yet a change in his diet was making his symptoms go away. And that told me, okay, I can't stay quiet about this. I almost have a moral, ethical obligation to report this to the world. But I also recognize no one will believe it. So I need to understand the science. And it was really that journey that started in 2017. I have now treated over 100 patients myself. I'm collaborating with researchers around the world. Clinical trials are underway. So I don't want anybody to think this is Chris Palmer's anecdote. It is way, way beyond Chris Palmer's anecdote. That started the journey for me to not only treat more patients and see life-changing remission of illness, recoveries, but also to do a deep dive into the science. And I set out on a path to just understand the science of how on earth could the ketogenic diet treat something like a serious mental disorder. And I ended up in a whole new place, which was developing the metabolic and mitochondrial theory of mental illness.
Which is amazing. And one of the things you really point out in your book is sort of the common pathway, the commonalities between psychiatric and metabolic disorders. And, you say, first of all, that there are commonalities between all these different mental disorders, whether we're talking about OCD, ADHD, depression, anxiety, schizophrenia, bipolar. I mean, any mental disorder increases our chance of having another mental disorder from between 2 and 30 times, according to your book, which to you suggests a common pathway to most mental and neurological disorders. And in fact, you talk about the research of Caspi and Moffitt, who talk about the P factor, right? And so they say there is one common pathway, but they couldn't identify what this was. Whereas you have come up with this theory, which identifies that P factor as being, and I quote from your book, mental disorders are all metabolic disorders of the brain. So how did you come up with this theory based on your research, and what does it actually mean? What is, the sort of essence of this theory for the layperson?
So I think the most important thing to say is that this research is really about integrating all of the existing research that we currently have. It is not new. In some ways, it should not be revolutionary. It is simply looking over the past century with all of the data we have accumulated, all of those neuroimaging studies that we have been doing tirelessly, all of the genetic studies that we've been doing based on the human genome, what exactly do those genes do? What are they doing that increases risk for neuropsychiatric disorders? But also looking at psychological and social factors. We know that trauma and childhood adversity increase risk for essentially all of the mental disorders, depending on what phase of life they occur in. So, something like autism spectrum disorder has to begin early in life. But if abuse and trauma begin very early in life, that dramatically increases risk for even autism spectrum disorder. But we also know that trauma and adversity early in life increase risk for all of the metabolic disorders, obesity, type 2 diabetes, cardiovascular disease, and premature mortality. So this theory is about looking at things that we already know to be true, the social determinants of health, all of the risk factors for mental health, and putting it together in a coherent way. And at the end of the day, the soundbite is what you mentioned, that mental disorders are metabolic disorders of the brain. And what that means, the science gets overwhelmingly complicated fast. There is no question about it. But if you do a deep dive into these tiny things in our cells called mitochondria, you actually can begin to understand what would cause a neurotransmitter system to become imbalanced. Why do patients with mental disorders have higher levels of inflammation? And why do higher levels of inflammation cause mental disorders? How does trauma and stress play into mental illness? Why do drugs and alcohol play such a critical role in illness? So in some ways, it's about confirming, but better understanding what we already know. But once you see the big picture, once you truly see the forest from the trees, it opens up entirely new treatment strategies like dietary interventions, like interventions that are focused on improving metabolism or metabolic health, interventions that are focused on improving mitochondrial health. And so some of these are common sense lifestyle strategies, but there are biotech companies actively seeking new medications that will do this, that will play a role in this. There are supplement companies and vitamins and other interventions that we can use, red light therapy, cold therapy, saunas. There are so many treatments that are available that we can use. So I think it's important to try to understand the big picture because it really does open up an entirely new world for people with mental illness.
Totally. And so just cycling back a bit, just to define a few things. So, metabolism, which is so crucial to this theory. So metabolism, according to your book, is the process of turning food into energy or building blocks for growing and maintaining cells, as well as the appropriate and efficient management of waste products. It's how our cells work and how we allocate different resources to cells to ensure our survival. And one of the things I loved about your book was, how you talk about trauma and the stress response, and how essentially what happens is that, when we're in fight or flight, when we're in a survival mode, when we have chronically high cortisol from childhood trauma or adverse childhood experiences, this detracts from our rest, digest, repair functions, which are so essential metabolically. And so the stress response has a very heavy metabolic toll. It diverts energy and resources from, the really important functions of cleaning up our cells and detoxing our bodies, etc. And so you talk a lot also in your book about underactive brain cells and overactive brain cells and sort of absence. So can you explain, sort of in the context of underactivity or overactivity in the brain and the stress response and metabolism? And I know that's not a particularly specific question, but if you can sort of touch on that.
So I think one of the important things is that there are many paradoxes in this theory. And one of the most prominent paradoxes is that if we go to the level of a cell, if a brain cell is metabolically compromised, few different things can happen. And in terms of the immediate future of that cell, so the next day, two things can happen to that cell. One is that, or actually three things, I guess, can happen to that cell. One is that it could function normally. Even though it's metabolically compromised, maybe the demands on that cell are not that great. And so it is able to perform its normal, usual functions. And that means if somebody has a metabolically compromised brain circuit, under times of tranquility and low stress, they may seem normal. They may not have symptoms. They may be fine. Then as soon as they are stressed, that increases the toll, or when you put increased demands on those brain circuits to do something, then the cells can actually become underactive or overactive. So underactive basically means as you stress those cells, because they are metabolically compromised, they can't keep up with demand. They don't have enough ATP. If you want to think about it in a simplistic way, they don't have enough energy. They can't do what they're supposed to do. And that's the way most people would think about a metabolically compromised cell. But the paradox is that the cells and the brain circuits can also become hyper-excitable or overactive. And because they require energy to turn off. And that means that cells can actually do things that they are not supposed to be doing. And as a rule of thumb, that means they can produce sensations or experiences or cognitions that are not normal. And that could be a panic attack for no reason. That could be a psychotic symptom, such as a delusion or a hallucination. That could be, OCD symptoms. And then the underactive brain cells can show themselves in other ways. So underactive brain cells can show themselves in terms of memory impairment or deficits or lack of motivation or inability to pay attention, those types of things. And in many ways, the way that I came to that was, again, integrating. I didn't just make it up out of thin air. I'm trying to integrate all of the neuroscience that we've got. We know with certainty people with mental disorders have underactive brain regions and overactive brain regions. And we need an explanation of why. But we also need an explanation of why does it wax and wane? If it is a permanent neurotransmitter deficiency, or if it is a permanent change in neurotransmitter receptors, we would not expect it to wax and wane. And yet it does. The symptoms do wax and wane for schizophrenia, bipolar, depression, panic attacks. All of the symptoms wax and wane for the most part. And we need an explanation. And in fact, the metabolic theory of mental illness offers coherent explanations based on everything we know. So sleep deprivation and stress and all of these other things can trigger symptoms. It gets more complicated than that because there can be neurodevelopmental problems. There can be neurodegenerative problems. Cells can die and atrophy as a result of metabolic dysfunction. And those are the ways to help us understand both neurodevelopmental and neurodegenerative disorders.
So would you say, for instance, so neurodevelopmental disorder being, for instance, ADHD, right, which is sort of a huge problem in our societies. All our kids are way over medicated with ADHD meds. How do you explain that in terms of your metabolic theory?
So essentially it comes down to mitochondria and all of the roles of mitochondria. Now, this may seem like shocking news to most people because there has been an explosion of research over the last 20 years that has completely shattered our understanding of mitochondria. They are doing so much more in cells than any scientist ever imagined. And if you don't know that fact that I just said, That is why this may all seem incredible and like quackery even. But if you do understand all of the different roles that mitochondria are playing, then we can start to piece things together. And so in the form of neurodevelopmental conditions like ADHD or like autism spectrum or other things, mitochondria and metabolism are playing crucial roles in the development of brain networks. And in many ways, that makes sense. If brain networks are growing and thriving and branching out, they require metabolic resources. In essence, they require food and oxygen because they have to grow new stuff. They have to grow new cells. They have to branch out. They have to make more neurotransmitters, more hormones, more dendrites, more axons. They are growing and thriving. And so you have to feed them. And if there is a problem with metabolism, or more specifically, if there is a problem with mitochondrial function, there can be problems in the ways that those processes are occurring, which can result in sometimes, for some people, permanent lifelong deficits. So ADHD usually is not, in my opinion, a permanent lifelong deficit, but something like autism spectrum can be. That social skills appear to go through a developmental window during which humans need to acquire social skills, and we acquire what we get. We acquire whatever we acquire. And if we don't get, or whatever social skills we get at a certain time are the social skills we are left with for the rest of our lives. And that, in my mind, may in fact be a permanent, irreversible process. And in some ways, it makes so much sense because social skill deficits or social skill differences in people with autism, they don't wax and wane. People don't have good days in which they're socially skilled and bad days in which they have social deficits. Their social skills are pretty constant throughout time. And that suggests that their brain is wired in a permanent and fixed way that way. And therefore, it's unlikely that we're going to undo that or change that. However, for the other symptoms, if a brain network is simply less strong than it should be, maybe because it didn't get adequate metabolic resources, we may in fact be able to make that brain network stronger. We might be able to, in other words, what we would be doing is inducing neuroplasticity. And if we can induce neuroplasticity and help those brain regions thrive and become more normal, if you will, and the important news, like I could talk about it as a neuroscientist and I could talk about it in a cell biology way. The reason that's important is because we can help people recover from what we call mental illness. We can improve their lives and reduce their symptoms and reduce their suffering.
100%. And that's what we're going to get to. And before we go there, because there are a couple of important things. So you've talked a little bit about ADHD. We know, for instance, you talk about permanent versus recoverable, and that leads me to think about dementia and Alzheimer's, which we also know it has very strong metabolic and mitochondrial components. So how do you explain dementia and whether it's recoverable or not in terms of your mitochondrial theory?
So dementia is an ongoing process that actually is occurring over a period of decades. And it starts with metabolic compromise in cells of the brain. And it's not just the neurons, it's astrocytes and other cells as well. But metabolically compromised brain cells will begin to malfunction. And therefore, it shouldn't be surprising that the very first hallmark signs of dementia almost always are psychiatric symptoms. Depression, new onset depression in somebody 75 years old is almost always the first sign of dementia in that patient. If you follow them longitudinally, even if they don't currently have significant memory impairment, 5 years later, there is a very high likelihood they will have dementia. And what those types of studies have told us over the last 20 years is that new onset psychiatric symptoms are the first sign of impending dementia. And so that starts with metabolic compromise. But if metabolic compromise continues, cells begin to shrink and then they can die. If cells are shrinking, if they are still alive, there is hope for recovery. Living cells can heal. It's called neuroplasticity. If you've got a weak muscle due to a broken bone in a cast, you can build that muscle up again. And I think about it in the same way with brain cells. So if somebody has very early signs of dementia, if their memory is beginning to fail, if they are showing other signs of psychiatric symptoms, there is a very good chance that if we use metabolic approaches to treatment, we might be able to slow that process and or possibly reverse that process. Now, the challenge is that once brain cells have died, there are few exceptions in the human brain in which stem cells can generate new cells in hippocampus, but there are very limited examples of that. And so once brain cells are dead, for the most part, we're not going to resurrect them. And that means that at some point in the process of dementia, there will be brain tissue that is permanently lost. Now, that doesn't mean we can't use metabolic approaches to slow the rest of the brain tissue loss, possibly even reverse some of it. We might be able to salvage some cells that are not yet dead. So I think it really depends on where the person is on that spectrum of atrophy versus cell death.
Got it. And so you mentioned all the roles of mitochondria, and I just wanted to read a few out from your book. You know, they help regulate metabolism. They help produce and regulate neurotransmitters, which I had no idea about. They help regulate immunity and inflammation. They help make, release, and respond to hormones. They help create reactive oxygen species and clean it up. They do fusion and fission, so they grow and they go back together. They play a primary role in genetic expression. And so they can turn, they're very important epigenetic factors, essentially, in turning genes on and off. And they're obviously involved in cell growth and differentiation. They eliminate old and damaged cells. And they really modulate neuroendocrine, metabolic, inflammatory, and transcriptional response to acute physiological stress. So they're so important. Now, tell me, one of the things you do in your book, which I think is brilliant, is you talk about what impacts metabolism in mitochondria, what creates mitochondrial dysfunction. And then the flip side of that is the solution, essentially. So whatever damages mitochondria and harms metabolism, you can then reverse and use to treat and to improve mitochondrial function and metabolism. So can you give us sort of the top key things that really harm mitochondrial function, and then how do we reverse it and fix their function, essentially?
So I think some of the top things are diet, and the details get really complicated fast in terms of, well, what diet? And so if you're looking for tell us the one food to eat and that'll solve all of our problems, it's not that simple. So it's about foods that we eat, foods that we shouldn't eat, foods that we should be eating that maybe we're not, foods that we shouldn't be eating that we are eating, how much food we're eating. So diet, exercise or lack thereof. Sleep is critically important. Lack of sleep is really bad. And I would say the other huge category are toxic substances. And those can be things that are irrefutable: smoking cigarettes, large doses of alcohol, large doses of marijuana are toxic to the human brain. And that is really undeniable. Whether smaller doses of alcohol and marijuana can be acceptable, and I don't need to go there and debate that. But so the treatment for a lot of those is obvious. So we can use dietary strategies. But again, I'm I'm using the ketogenic diet with patients who have very serious treatment-resistant chronic mental disorders in the same way that neurologists use the ketogenic diet to stop seizures in patients with treatment-resistant epilepsy. And the neurologists don't think of themselves as lifestyle medicine physicians. They are trying to stop seizures, and they are using anything and everything in their power to do that. And when I talk about the ketogenic diet, I actually think about it in the same way. I'm not saying the ketogenic diet is the best diet for all humans to be on. I'm not saying everybody needs a ketogenic diet. I definitely don't believe that. But I'm saying that the ketogenic diet can be a powerful intervention when needed or when indicated. Many other dietary strategies, Mediterranean diet, reducing processed foods, all of those things can play a role. In terms of exercise, that's fairly obvious and straightforward. Get some movement, don't sit all day. In terms of sleep, sleep deprivation is a critical factor in the exacerbation and even the beginning of new mental disorders. And so, but we know that sleep deprivation triggers so many mental disorders really across the whole spectrum. Mood disorders, psychotic disorders, personality disorders, eating disorders, substance use disorders, all of them get worse with sleep deprivation. And so adequate sleep is really critical. And then reducing toxic substances. I think one of the most disruptive parts of my theory that I was actually not allowed to fully kind of express my real strong opinions on. But the most disruptive part of my theory is that we in psychiatry prescribe medications that cause metabolic harm. That is undeniable. We prescribe medications that cause massive weight gain, that cause type 2 diabetes, that increase all of the biomarkers of cardiovascular disease, and that cause premature mortality, certainly in the elderly. The FDA here in the United States has all of those warnings right on the package insert. And so one of the challenges is, well, then, Chris Palmer, then your theory must be wrong because those medications are so good. Well, no, that's actually the disruptive part of this theory, is that we need to understand that in some cases, the very treatments that we are prescribing for people can, in fact, be toxic substances to mitochondria and metabolism. And therefore, we need to be mindful of that, and we need to develop a comprehensive treatment plan. Now, for any of you who are clinicians or patients or family members, you all need to hear this. Do not stop your psychiatric medications on your own. Do not do that cold turkey. It is a disaster. It's a recipe for death. It's a recipe for suicidality, for psychosis, for mania. Do not stop your medications on your own. However, we might want to slowly reduce medications in a thoughtful and safe way. And we might want to prescribe medications that might be harmful to metabolism for shorter durations of time. Instead of telling patients you're going to be on this for the rest of your life, we might only want to use it for a few months through a psychotic crisis. When the patient is a danger to themselves or others, we may very well use antipsychotics still, but we might start to think about them the way that we think about chemotherapy. Chemotherapy can be life-saving, but we are delivering poison. We are trying to poison the cancer without poisoning the patient. And in some ways, I think that we need to refine our understanding of what we're doing in psychiatry, refine our understanding of the medications that we're prescribing, and hopefully come up with better treatment strategies that ultimately promote health and healing and recovery and remission.
Well, especially if, if you look at your theory of metabolism and mitochondria and brain energy, essentially, as Professor Lustig would say, these are essentially foodable or lifestyleable rather than druggable. And so lifestyle interventions and dietary interventions and sleep and exercise are seem to be much more effective in terms of regulating metabolism and improving mitochondrial function than any pill that you can ever take. And so I think, that's really important to realize. And I'm curious, though, as to what are the mechanisms, for instance, of this ketogenic diet? Why does it work well in terms of improving mitochondrial function, if that's the way it works? And also, I'm slightly conscious that, maybe some people don't understand the concept of mitochondria or ATP. And so mitochondria are sort of the power, the batteries, the energy power cells inside our cells, and they produce ATP, which is sort of the energy. But as you point out, they do so much more. So how do these dietary interventions, especially the ketogenic diet, work in terms of metabolism and mitochondria to be so effective?
So I actually really hear your question is almost two separate questions. And one is, how do generic dietary interventions or dietary patterns impact metabolism and mitochondria? And that may be more applicable to the masses and to general health and wellness kind of recommendations. But then the other question that I hear is, what about this ketogenic diet? What is special about it and what is it doing? Because the ketogenic diet is actually mimicking the fasting state. So we are actually mimicking no food. We're mimicking no diet. Now, obviously, no diet and actual fasting, water fasting, produces similar results. But you can only fast for so long before you starve to death. So the ketogenic diet, in a way, is almost trickery, that it's a way to trick the body into thinking that you're fasting when you're really not. So we can provide it enough nutrition, but we're getting the benefits of the fasting state. And so interestingly, for those who don't know this, we know more about the effects of the ketogenic diet on the brain than we do any other dietary intervention. And that's true because neurologists, neuroscientists, biotech companies, pharmaceutical companies, and others have been studying the ketogenic diet, understand how on earth does this diet stop seizures when our medications don't stop the seizures, because they're looking for new mechanisms of action. And so we actually know a wide range of things. The ketogenic diet is changing neurotransmitters, it's decreasing inflammation, brain inflammation. It is changing gene expression, it's changing hormones, it's doing all sorts of things. But central to my thesis, the primary target is that it is improving mitochondrial function through two processes. One is called mitophagy, which is the process of getting rid of old and defective mitochondria and replacing them with new ones. And the other is something called mitochondrial biogenesis, or the production of new mitochondria. So bottom line, when people are on a ketogenic diet for months or years, their cells will actually have more healthy mitochondria at the end of the day. And I believe that is the magic of the ketogenic diet, that it helps those cells function more properly. Now, getting back to the generic dietary recommendations, we know that lots of sugar and processed foods are really bad for mitochondria and cells. High levels of high fructose corn syrup are actually changing mitochondrial biology in adverse ways. Alarmingly, artificial sweeteners are increasingly being implicated in all sorts of bad things. So we have good epidemiological data. People who consume a lot of artificial sweeteners are more likely to have a broad range of mental disorders. Those are based on human studies, epidemiological. So we can't do randomized controlled trials at this point where we have half the people drink Diet Coke and half the people drink regular Coke. That would probably never be approved by an ethics board. But in animal models, we do know that something like aspartame, which is ubiquitous in our food supply, in all of the diet products, the diet sodas and diet candy and other things, aspartame increases the risk for anxiety disorders in mice. And we know that it does that. We've got brain imaging that the amygdala becomes hyperexcitable in these mice, that genetic changes are occurring. The devastating news, at least in the mice, is that this gets transferred for 2 generations of additional mice, even though the baby mice and the grandbaby mice are not exposed to aspartame. So if your mother or your grandmother drank a lot of Diet Coca-Cola, that means you may be at higher risk of an anxiety disorder because of her use of Diet Coke. And God only knows what other substances are in our food supply that we just have no idea about. And the microplastics that are in our food supply, we know that those are doing all sorts of things, including impairing mitochondrial function, causing higher levels of inflammation. And the microplastics are ubiquitous in our water supplies and everything else. So unfortunately, diet gets really complicated fast. The great news is that we can clean it up and just eat real whole foods. That's the recommendation. Eat real whole foods.
That is the key. And you talk about fiber, the importance of fiber to make butyrate and the importance of butyrate for mitochondrial function. But in the keto diet, there's not as much fiber. So how do you explain that the keto diet is so amazing for the brain if it's lacking in fiber and therefore in butyrate and there, you know, or would you say that that's the wrong interpretation of the ketogenic diet?
So I would say 2 things. So one is it can definitely be the right interpretation of a ketogenic diet. And for other people, it's definitely not the right interpretation. So there are people who are on vegan and vegetarian ketogenic diets. They are getting more than enough fiber from plant-sourced foods. There are people on kind of omnivore ketogenic diets, which is usually what I recommend to people, which means that they might be eating a protein source, they might be eating sources of healthy fat, but they are also eating low carbohydrate vegetables, spinach, lettuces, asparagus, cauliflower, broccoli, which all have more than enough fiber. So for some ketogenic diets, there's no question. But the other thing is that the ketogenic diet produces ketones, and ketones are also a source of fuel for mitochondria. And it may very well be that some people can do well on, say, a carnivore diet, which has very little, if any, fiber. It may be that some people can do well on that because the ketones and the fats from their diet are fueling the colonocytes and helping them function normally, reducing inflammation and other things.
And speaking of inflammation, what is the relationship? Because we all know that there's this huge correlation between mental health disorders and inflammation. And we know now that, you know, depression, anxiety, bipolar, all involve an inflammatory mechanism. What is the relationship between metabolism, mitochondria, and inflammation?
It is all bidirectional. So I tend to think about it as a circle. Most people think of things as linear relationships. So you get, say, Lyme disease, that causes inflammation, that causes your brain to malfunction. And that's a line. Most of biology doesn't work in linear relationships. Instead, it works in circles. And so you may get Lyme disease, that causes inflammation, that causes mitochondrial dysfunction, that can cause your immune cells to now malfunction. That can be a chronic source of inflammation. That can allow the Lyme disease to not, the spirochete to not be cleared from the body. And now you've got chronic lou. And so we have very good data. Actually, a paper just published today, 2013, in March 13th, 2024, in Nature. The mitochondrial complex 1 is instrumental in neuroinflammation. So mitochondria in microglial cells plays an instrumental role in chronic neuroinflammation. Now, this has implications for things like multiple sclerosis, but also for schizophrenia, bipolar, alcoholism, everything else. So sometimes there's a clear cause of inflammation, such as an infection, long COVID, other things. But other times when cells are metabolically compromised, if your cells are metabolically compromised from a poor diet, that will cause chronic inflammation. And we know that that occurs, that chronic low-grade sterile inflammation is occurring in most at higher frequency, at least. It's not 100% of all patients, but it's more likely to occur in patients with essentially all of the mental disorders, but also, all of the metabolic disorders, obesity, diabetes, cardiovascular disease, cancer. That these patients with metabolic compromise are more likely to have higher levels of inflammatory biomarkers.
Understood. And then moving quickly before we go to the audience questions to the psychosocial aspect. So you talk about trauma, and I was very interested to read the Rachel Yehuda studies about intergenerational trauma affecting mitochondria and the genetic expression in offspring. Can you explain that a little bit and the role of trauma and ACEs in relationship to this mitochondrial dysfunction, essentially?
So again, I want to start with the common sense empirical observation. So we know that high levels of trauma and adverse childhood experiences increase risk for essentially all of the mental disorders. They also increase risk for obesity, type 2 diabetes, and cardiovascular disease and premature mortality. So we need to understand. So those are facts. They're called the social determinants of health. We have an abundance of data on that. And we need to pull our heads out of the sand and reconcile that. How is it that trauma can cause all of the metabolic disorders and the mental disorders, and how does that work? And increasingly, we have evidence. So this is probably one of the weaker areas of evidence, like with hormones and neurotransmitters and infections. Those are easy to study, and we can use animal models to study those. Trauma and stress are harder to study, and it's harder to specifically attribute biological changes to the trauma. But again, the large epidemiological studies I just shared with you paint a very powerful signal of, wait, there's something probably here. And we do have evidence. Trauma and stress, I think you kind of alluded to this a little bit earlier even. So trauma and stress in the short run, they increase metabolic rate. And they do that as a survival mechanism. So that is through sympathetic innervation, that is through catecholamines, it is through cortisol and other things. Cortisol itself, when you take isolated cells in a petri dish and add cortisol, the mitochondria actually start producing more energy in response to cortisol itself. And in a way, this makes sense. It makes intuitive sense. The organism is on high alert. The organism needs to fight or flee. That means we need energy ready to go. We need energy mobilized. We need glucose levels to be higher. We need our heart rate to be higher. We need to be ready to fight or flee. And that is all adaptive. There's nothing pathological about any of that. However, when it goes on for a prolonged period of time, it starts to take a toll. And resources are being diverted to this high heart rate, these higher levels of glucose, everything, being ready to fight or flee, even if you don't need to fight or flee. Just being ready to is taking a toll. And in the simplistic way, it's diverting energy that should be going toward maintenance functions, toward restoring cellular health and brain health, doing repairs, detoxifying cells, all of that. Instead of sending resources to do that work, the resources are being used for self-defense. And there are lots of granular details. There are these things called stress granules. That was kind of a pun. That actually you can do a deep dive into some of the science of how exactly does this play out at the cellular level. The good news is that we've got a lot of evidence that it does, in fact, play out. But it's a way to help us understand that. And then the treatment then, again, in my mind, instead of just sending people to trauma-informed therapy and have them talk about their trauma, for some people that works and it works great. And I don't want to stand in the way of that. And if trauma-informed therapy helps people heal and recover and go fully into remission, I'm 100% for it. But anybody who's in the mental health profession knows there are so many patients that just doesn't work for. They talk and talk year after year after year about their trauma, and they are debilitated. They are debilitated with both psychiatric symptoms and metabolic health symptoms. They are more likely to be gaining weight. They are more likely to be developing type 2 diabetes. They are more likely to be developing cardiovascular disease, and they on average are dying early deaths. And what I'm saying is that we can more effectively help them if we target metabolism and mitochondria. And we can do that through lifestyle interventions like diet, exercise, sleep, others. But we may want to use supplements, vitamins, mitochondrial modulators, red light therapy. There are so many options that this theory opens up. And I feel like this is all available today. Let's do the studies. Let's get this going. Let's help people now. For the clinicians listening or for the patients, we don't need regulatory approval for most of these treatments. These are things that are available today. You can try them.
Yeah.
As a scientist, I understand we're not going to get these treatments into clinical practice until we have more of an evidence base. And so I say, let's start developing that evidence base now. Let's help these people heal and recover now.
And in your book, you're absolutely brilliant about all the different lifestyle interventions that we can use. And you talk about, for instance, the science of relaxation and the relaxation response and how that has been shown with blood samples to improve mitochondrial function, reduce reactive oxygen species, etc. So, I think it's so important to look at your book and see the many interventions that we can have. And just before I go into these questions, and there are quite a few, our current lifestyle is so overstimulated with screens, and I worry about our children and our adolescents and the amount of stimulation that they're getting. How do you then, and this increase in ADHD, so you have a theory in your book which is very interesting. So is their mitochondrial energy and their metabolic brain energy being drained by this overstimulation, or are they drawn to these screens as they may be drawn to drugs or alcohol in order to medicate a lack of metabolic energy in the brain?
And I think the real answer is it's probably both. I think, again, vicious cycles that somebody might come out of the womb due to maternal infection or maternal poor metabolic health. So a woman who is overweight or obese, has type 2 diabetes, and gets an infection while she's pregnant is at higher risk. That child is at higher risk of having a wide range of neuropsychiatric disorders, including ADHD. Now, so that child comes out already predisposed. The child's done nothing wrong. There's no shame, no blame, nothing. And the poor woman, she didn't know any better. She's just doing the best she can. So this is not about blaming and shaming. This is about understanding. But this child comes out of the womb predisposed to ADHD, now is developing symptoms of ADHD. The ADHD is going to make the child much more likely to go to the screen because the screen is fast-paced, it's engaging, it's designed for people with poor attention. That's the people who are creating screens and the content that we see on these screens are creating it for a low attention span. And so that child is now engaged with that. Now that child is not learning how to sit with his own thoughts. He's not learning how to sit still. He's not learning how to read. He's not learning how to engage with other humans and make eye contact and have a back and forth conversation. And so the screen itself is now contributing to the cycle and contributing to the weakness of brain circuits or the lack of metabolic resources going to those brain circuits, and that makes them even more vulnerable. And then it's just a vicious cycle that can perpetuate itself. There are many interventions that we can do for those children, though.
Interesting. Just like a couple in a nutshell.
So couple would definitely look at diet, obviously getting off that screen. So let's start to limit the screen time, even if that means a fussy or fidgety child. And that means educating the parents. It means educating the parents, and in a non-shaming way, a non-judgmental way, like, hey, we're all just here to help. Your child's been diagnosed with ADHD. Instead of just throwing pill after pill at your child, maybe we could try to augment what we're doing or even replace what we're doing with some behavioral and lifestyle strategies that might help your child thrive in the future. It's going to be a little more work than just putting a pill in his mouth, but it's going to be well worth that work. So we've got to educate the parents, get them engaged, get them motivated to do the treatments. And so we're going to reduce screen time. We're going to add exercise. We're going to make sure the child is sleeping adequately, because a lot of times when people are on screens, they're not getting adequate sleep. And again, all of that, the lack of exercise, the lack of engagement with other humans, the lack of sleep is all fueling this vicious cycle of neurometabolic dysfunction. So those are easy, common sense strategies that we can begin to implement. And we can start to at least slow the progression and or hopefully reverse the course and help these people heal and thrive.
Got it. So what I'm going to do, Dr. Palmer, is I'm just going to quickly read all the questions that have come in, and then you can answer them according to. So the first one is, how do you increase metabolism if blood illness causes inflammation of blood vessels, which in turn reduces energy levels? So maybe actually I'll try and just rapid fire. So that's the first one.
So if you've got a blood illness causing inflammation, I would want to know what that blood illness is. And there are different types of blood illnesses. So a blood illness to me could be an infection, a virus, a bacterium, a parasite. A blood illness could potentially be a hormone imbalance or something. So it could be a toxic substance, mercury poisoning, microplastic poisoning, other things. So I would want to understand what the root cause of that illness is, see if we can address it. And if we can address it, then that will help reduce the inflammation, which will in turn start to break this vicious cycle and help people heal and recover. But again, all of the strategies that we've been talking about, diet, exercise, sleep, but vitamins, supplements, light therapy, other things, all of those can be anti-inflammatory in the right circumstances and can also help to break the vicious cycle.
So it's enkavasculitis. Okay, so thank you for this interesting talk. My question is it a diet that leads to the mental disorder or a mental disorder that leads to metabolic problems? Regardless, but especially in the latter case, would changing the diet be even possible?
So it's a great question, and I think both are true. Again, think vicious cycle as opposed to linear relationships. So poor diet can lead to poor mental health, but poor mental health due to trauma and childhood adversity can lead to metabolic problems. Even if the child is eating a good diet, you can feed that child the cleanest diet, whatever that is in your mind. And if that child is being abused and tormented, that child is at high risk for a mental disorder. And once that child develops a mental disorder, they are much more likely to develop all the metabolic disorders as well. In that latter case, can changing the diet be possible, and can it help? Yes, that is the good news. We're talking about breaking vicious cycles. So cycles can start anywhere in the circle and then perpetuate. And so is it possible? It is. One of the questions that I'm most commonly asked is, Dr. Palmer, how can you get anybody to stick with a diet, let alone somebody with schizophrenia? That's impossible. Those people can't do diets. And what I'm here to tell you is please, please, please do not underestimate people's determination to get better. Give them a chance. Have some faith in them. And that means they deserve some support and encouragement. And if they fall off the wagon, if they break the diet, don't give up on them. You're going to stand behind them. Just like if you're trying to get an alcoholic to stop drinking alcohol, we don't say, stop drinking. That's the end of my intervention. The intervention is clear. We have tools and strategies and support and education and all sorts of things for them. And there's no reason why we can't do it for these people. And some dietary interventions, even if a poor diet wasn't the root cause, some dietary interventions like fasting, intermittent fasting, ketogenic diets, and others can restore health, because it's about restoring mitochondrial health.
Exactly. Thank you, Dr. Palmer, for explaining such complex concepts in such a simple way. My question is, I'm a woman in my 40s. Is there a way to figure out my brain cell health through scans, for instance, and then work out which diet, whether the keto diet or some other diet, I should follow for optimal mental health?
So it's a great question. So Daniel Amen has SPECT scans that he offers through the Amen clinics. His scans are actually measuring brain metabolism. So they are delivering a tracer. I talked with Dr. Amen. He said, after I read your book, I turned to my chief scientific officer and said, you know that tracer that we're injecting into people? Does that have anything to do with mitochondria? And his chief scientific officer laughed and said, yes, 70% of it is going into mitochondria. That's precisely what we are measuring with our SPECT scans, is we are measuring mitochondrial activity. So his SPECT scans are measuring areas of lower metabolic health. Do you need a SPECT scan is less clear. So it's nice to get that information, but I'm not convinced. A lot of people can't afford it. So I just want to make clear, I don't think most people need it. You know whether your brain is working well or not. Like if you're thriving, if you can remember things, if your mood is good, you probably don't have a brain metabolism problem, or at least not one significant enough that you need to address it. If things aren't going well for you, if you're having psychiatric or neurological symptoms, then we already know we've got a problem, and now we need to come up with strategies. Can that brain scan inform whether a keto diet or some other diet is optimal? No, unfortunately, we are not anywhere there. We don't have genetic studies. We don't have biomarker studies. Our field desperately needs that, wants that. But right now, we cannot prospectively say who will do best on what dietary patterns, because dietary patterns can depend on your gut microbiome. And we know from just even relatively small but very rigorously done studies, one person can eat a banana and have a massive spike in blood glucose. And another person can eat that same banana and have just a tiny increase in blood glucose. And it almost certainly involves the gut microbiome and levels of inflammation and hormones and so many other complicated things. So unfortunately, it leads to a universal thing that I do say. There is not a one-size-fits-all diet for all humans, for all health conditions. We need to think in creative and open-minded ways and let people know that we will keep trying different dietary patterns until we find one that optimizes your health. How will you know what's right? Your symptoms will get better. Your biomarkers will get better. If you have high blood pressure and you try a new dietary pattern and your blood pressure comes down, keep doing it. That's a great biomarker of an improvement in your metabolic health. If your blood sugars normalize, if you're pre-diabetic and now you're no longer pre-diabetic, keep doing whatever intervention you did.
Got it. Apologies, I missed some of the talk and wondered whether you'd covered anything to do with relieving menopause symptoms. And in fact, we haven't really spoken about the relationship between metabolism, mitochondria, and hormones. And there's a big chapter in your book on that, which is fascinating. But just to answer this lady's question, I guess the relieving menopause symptoms using a sort of mitochondrial metabolic approach, maybe?
Definitely. So we know that estrogen, so if you don't know this, all of the steroid hormones are actually produced by mitochondria. They control the first step in the synthesis of steroid hormones. So those include cortisol, estrogen, testosterone, and progesterone. So, but then steroid hormones go on to have effects on mitochondria and other cells. And there's no doubt estrogen is a master regulator of brain metabolism in men and women. This is not a female thing, but yes, it definitely applies to women, especially when they're going through menopause. But it also applies to men. Estrogen is a brain metabolism regulator. And so, unfortunately, when women go through menopause, if they are vulnerable, not all women have problems. Some women do just fine through menopause. But if a woman is vulnerable to brain metabolism problems, that means that as the estrogen goes down, her brain is more likely to experience metabolic dysfunction, which may reveal itself in the form of neuropsychiatric symptoms. And that could be depression, anxiety. In some cases, it could be bipolar disorder. In some cases, it could be migraine headaches and other things. But are there strategies? Yes. I think if we focus on brain metabolic health, so that's a broad category. And there are many interventions: diet, exercise, sleep, stress reduction, maybe reducing harmful substances. And harmful substances is really important for this one, because some women may have been smokers all their lives. And they think, well, I can tolerate smoking. I never had problems before. And now they go through menopause and they're still smoking. And now they've got really bad symptoms. I would actually say to that woman, well, you can't handle smoking anymore. Your brain can't handle smoking anymore. Maybe you could handle it before, but now with menopause, you can no longer handle it. So for some people, just cleaning up lifestyle can make a big difference. There's no doubt using exogenous hormones, hormone replacement therapy, and others are definitely options. I would ask you to consult with a medical professional who knows how to use them safely and wisely. Make sure we're paying attention to cancer risk and other things. But they can play a role for a lot of women.
Got it. So we just have time for a couple more questions. This has been fascinating. Thank you. Is there a way to balance a good diet with food taste and texture issues? And could there be a link between the two? And I wonder if she's maybe talking about sensory processing issues. Does that make sense?
That's what I would assume. So there are definitely people who, even with avoidant restrictive feeding and other kind of eating disorders, there are people who have trouble with food tastes and textures. And the real answer is yes, it's a challenge. I'm not going to give you a simple cookie cutter kind of recipe. I'd want to level with you. Yes, of course, it's going to be challenging to figure out what foods can we eat and how can we optimize this person's metabolic and mitochondrial health. But what I want to empower you with is knowing that the food that they are putting into their mouths and in their bodies is probably playing a profound role in the eating disorder itself. And those people are stuck in a vicious cycle. Those people are eating the wrong foods. That may be causing gut inflammation. That might be affecting their brain function, including their feeding centers and their hunger centers and their sensitivity to food textures and tastes. And that is causing a cycle. And so we may need to really be diligent about figuring out, can we find a solution? Can we work with the person with food tastes and textures that they can tolerate for now in the hopes that we will restore health so that maybe 2 years from now, they'll be able to tolerate a more normal diet with more varied food tastes and textures. There is no doubt that that can happen for a lot of people. I know people for whom that has been the case. They were stuck in a vicious cycle of an eating disorder, or restrictions around certain foods. And by restoring their metabolic health, they got to a point where they became much more tolerant of changes in diet, and they could go out to eat with friends and family for the first time ever. And so although it can be frustrating, and although it can take some time and detective work to figure out how can we do this, it's worth the effort. And I just want to say, you're not wasting your effort. There's real reason to think that changes in diet could play a powerful role in some of these patients.
And it is so unfair because, of course, if you're metabolically compromised, you're craving sort of quick fixes and sugar. And of course, that's what you go for, right? And that's the worst thing that you can have.
Absolutely.
So as you were saying that sleep deprivation is not good for mental health. If you're someone who suffers from regular poor sleep despite good sleep hygiene, what else should you try? Is medication or melatonin worthwhile in the short term, or does it make it worse?
So medication can be helpful for people with acute stress-induced insomnia. So if you are traveling and you have jet lag and you know that medication can help you get back on a regular sleep cycle, go ahead and use it. If you're going through a really stressful or traumatic event and you're unable to sleep and medication can help you sleep, I'm all for it. But if you have chronic sleep problems, even with good sleep hygiene, what that tells me is that there is something wrong metabolically or mitochondrially. There is something wrong. And I would really encourage you, try to figure out what that something wrong is and fix it. Now, for some people, it could be a light exposure thing. So the simplest solution I have is use bright light therapy every morning to try to regulate your circadian rhythm. And then that means 2 hours prior to bedtime, no minimized light exposure, no computers, no television, no phone. You probably are thinking that would be so boring. Yes, it would be boring, and it'll be so boring that you might get sleepy and want to go to bed. And then guess what? You'll go to bed. You'll give in to your body cues and you'll go to bed, and hopefully you'll get a good night's sleep. Now, substance use plays into poor sleep. So if you're drinking caffeine beyond 10 a.m., stop drinking caffeine beyond 10 a.m. And that's in all forms of caffeine. So coffee, tea, soda. Is that a universal rule for all humans? No. If you are able to drink coffee in the afternoon and not have any problems, go ahead, keep doing it. But if you're having trouble sleeping, then maybe you need to pay attention to your substance use. Use of alcohol is horrible for sleep and sleep cycles. So if you're drinking alcohol at all, I would encourage you to give up alcohol for at least 2 weeks and see if that can normalize your sleep. If your sleep normalizes after that 2-week period, and then you reintroduce alcohol and you have trouble sleeping again, well, now you've got a decision to make. You know what the problem, you know what's causing it, and you have to decide, would I rather sleep or would I rather drink alcohol? Or can you find the right balance? Can you drink less, or could you drink other types of things? Or, so it gets complicated fast, but those are some very straightforward strategies that I've seen work countless times.
And a very final question, which is more sort of a comment about adult ADHD and the ability to hyperfocus versus getting distracted by other things. I guess, how do you explain that in terms of your metabolic energy theory? This sort of ability to hyperfocus versus the distractibility, and the fact that ADHD is not just neurodevelopmental. Some people have it for their whole lives.
So some people do have it, and for their whole lives. The ability to focus on things is regulated by brain circuits. And again, what I'm arguing is that when brain circuits are metabolically or mitochondrially compromised, they can become overactive and underactive. So they're not, one cell is not simultaneously overactive or underactive, but one cell in the course of a day could be underactive for 90% of the time, and then hyperactive for 10% of the time. And so the hype, I'm wildly speculating now, and I just want to make that clear. Like, I don't think we really fully understand why are people with ADHD able to hyper focus when they are unable to focus at other times. But that paradox that I just described at least offers one possible explanation. I could come up with other possibilities. The real answer is no one knows. The real answer is we don't fully understand why that happens. What we do know is that it does happen. It is a thing. And people with ADHD can sometimes, not always, but some people with ADHD can have sustained periods of hyperfocus and hyperproductivity. And if they're doing something really useful and productive, like schoolwork or a business project or work product, it can be extraordinarily useful. If, on the other hand, they're playing a video game with hyperfocus, I'm not sure that that's really serving them or society all that well.
Agreed. Dr. Chris Palmer, you were amazing. Thank you so, so much for your time. Thank you to the How-To Academy. Thank you to you. You are wonderful. Your book, Brain Energy, is a must read, I have to say, and keep doing the wonderful work you're doing in the world. And we're all incredibly grateful to you for pioneering this approach and changing lives and revolutionizing mental health. So thank you.